Hello viewers, welcome to Madhuviti Logs. Thanks for watching my previous video. In my first video, I spoke about what is ER, what is life in ER, and why I like emergency medicine, what's the process of patient entering into ED. And to my surprise, I got a very good response to my initial video. I'm so happy. I'm so thankful to all who are watching my video. Thank you very much once again. Please like, share and subscribe and keep showing your interest in my videos. I'll create more good videos for you and more interesting information about emergency medicine in my videos. Thank you all. So, with the great boost you have given to me, I've decided to make the second video, the video on COVID-19 inside the ED situation. Presently, we are in all COVID-19 circumstances, and there might be people who are interested knowing in what happening behind those doors of ED. So, I just want to give the information about what happening inside the ED. Without any delay, I'll take into the inside the ED pages. Let's enter into my channel Madhuviti Vlogs. But before that, don't forget to like, share and subscribe. Only if you subscribe, you will get updates about my next videos and notifications, and you can keep watching interesting information. Hope you will support me. And without any delay, like, share and subscribe, and we'll enter into my channel now. Coronavirus. This is one thing I should say has shaken every cell in my body. I don't feel ashamed to say that, because the amount of fear it has caused, or the amount of stress it caused. I think this is a situation where our generation has never seen before, or may or may not see in future. This is totally a different experience. On the other hand, inside the ED, when the lockdown announced on 23rd March as a step to prevent the spread of this virus further, even before that, we started seeing cases of coronavirus. I first saw my COVID-19 case in January, as I was working at that time in a different hospital. As a trainee doctor, we do rotate into different hospitals every year or 6 months. So I was in a different hospital, and this was my first case. And there was a big discussion among a consultant group and the registrar group, and all together we were discussing what we have to do about this patient, whether to admit him, whether to send him home. He wasn't too sick, luckily. He had mild symptoms, but clearly it was a suspected case, as already we have information from Public Health England. So we have isolated him in a negative isolation room, and we have taken full infection control precautions as we do with any infectious case. And we were discussing about whether we should do an x-ray or not, because we were suspecting the case to be a coronavirus. We've gone through the Public Health England guidelines at that time and finally decided to discharge this patient home, as he was otherwise okay. Advised him to watch for any worsening of symptoms, and safety netted him what to do when if his condition worsens. And from there, that day we never know that this situation will worsen this much, and we have to see to be in a circumstances which we are presently facing. That really surprised me, how the things change so fast. Presently, I mean, it's good to know that the peak we passed, and the numbers are coming down, but we've gone through a lot of steps and a lot of process during last 3 months. Initially, in phase one, when this virus was in initial stages, the spread was in initial stages. Phase one is like we were doing swabs of suspected cases in special hubs created in the hospital. The one doctor or nurse who are trained and who have fast fit mask test used to go into the hub along with the patient, and they go with full mask and surgical gloves, apron, everything, and then they take the swab, and the patient, they'll examine briefly and take the history and see how he is. If they are safe to discharge home, they will be going home back from then and there, and they don't even step into the ED. That was phase one. Then slowly we started getting the numbers rising, and they started coming to our ED. When these cases started coming to ED, initially the numbers were not that bad. It was like maybe 2 or 3 cases in a day, something like that. So we allocated few cubicles in the ED for this patient, and these are seen by a staff who only care for these patients. In a shift, every shift we allocated staff, specific staff to look after these cases, and a specific doctor to look after these cases, so we avoid the cross contamination in the department. As things got worse, we entered into phase 3, where we started receiving these cases in large number. At one point, it was only COVID-19 suspected cases. There was no other cases at all. The routine ED cases like headache, abdo pain, all these numbers has come down. And if we received any normal cases, they were also had symptoms of COVID-19. So we were almost seeing like every patient was COVID-19 patient. So at that time, we divided our department into 2 halves. So one half was a red zone and the second half was a blue zone, where in red zone we were seeing only COVID-19 suspected cases. Blue zone was our clean area, where we were receiving the routine ED cases, so that we avoid cross contamination, and we were trying to ensure the infection control policies strictly by watching continuously the practice in the department. It was a very tough time because there was so much of stress, emotional distress, and a vibe in the environment. Though we were receiving help from external resources, like people has responded tremendously, very well during the situation. Actually, they tried to maintain the measures which the government advised. Although there were cases coming into the ED, there was huge support from the public to the ED by providing food, by providing masks, by providing resources which we need to continue our practice. That was really, really helpful. And we are all thankful for their support, and we hope their support continues in the near future. But there were some other things which were bothering us. We had 2 challenges at that time. First one foremost was like to take care of these patients who are coming with infection and make sure they are treated properly. The second biggest challenge was not to spread the infection around. So we need to maintain the strict infection control policy. But we don't have enough supply of FFP masks or enough supply of the gowns or hoods. And ED is a hub where we also see aerosol generalized procedures. Emergency medicine department is a critical area where aerosol generating procedures happen. Aerosol generating procedures are one as a medical or a healthcare procedure where there is a chance of production of airborne particles or respiratory droplets, which can risk the healthcare worker to have the infection. So these kind of procedures are commonly done in ED. For example, like putting a tube inside the windpipe of a patient who's requiring a ventilator, or doing a chest compression, or Some say that giving high flow of oxygen is also a AGP procedure. So we have to do these procedures on a regular basis in ED for all the sick patients, and we were at high risk. There was a huge amount of fear in all the staff of catching this infection, and they're worried about their loved ones of having this infection or taking the infection home, which was really, really concerning at that time. But we all know at the end of the day, we have to do our job, and this is the sole purpose of joining this career. So, I mean, no one has backed up in doing this or their job, which they are supposed to do. Everyone showed the same enthusiasm, same response to every patient, though inside they were scared, inside there was a lot of stress. I've seen people crying after the shift, seeing the dying patients where we couldn't do anything, but still we were all together and we stood up for the situation. And I feel I'm proud of what I am now, and working as an emergency physician. This is what we need more in our country, and I think this is why we need good emergency physicians and good emergency staff. Having said that, there was something which really made us tearful, like one of our colleague has passed away with coronavirus, which was so difficult to take. It was a heartbreaking situation, but still, at the end of the day, our purpose is to serve the people, and we'll keep doing that. Hope you like this video. I don't think I can continue any further this, but in my next video I'll talk more about inside the ED coronavirus, and also I'm planning to do some videos on about my training in emergency medicine, how I entered into training, what I did, what course I did, and how I got my job in UK. So keep watching my videos. Please like, share, and subscribe. Hope you will extend your support and spread this information to the people who are in need. Thank you so much for your time. Enjoy the day. Bye bye.